And that is the experience for many who will spend time in quarantine. Let's now get some perspective from Dr. Githinji Gitahi, the Group CEO, Amref Health Africa. Dr. Thank you for speaking with us this evening. Of course, I want to get your reaction to that story, but I'm also sure you're not surprised. We've seen this before with previous epidemics as well. Dr. if you can hear me. Okay, Dr. you seem to have a...
Can you hear me now?
There we go. There we go. Thank you. Welcome to Newsnight. Your reaction to that report?
Thank you very much, and sorry about that. Stigma has been associated with many things. It always arises where people associate a particular risk to themselves with an individual, a situation, a place. And therefore, we've seen this even in previous illnesses. Like HIV had huge stigma in the early 80s. We have seen stigma in Ebola. We have seen stigma in other areas. But the reaction to this story is that, it's kind of a dual reaction. First, I empathize with Wangui, and I also celebrate her for coming out and speaking openly about her challenges, because this is really what then helps us to overcome and kind of eliminate this curve of stigma that is rising and is a big concern.
I'm guessing you'd also recommend that others who are brave enough to should also come out as well and share their experiences. But what are the long-term dangers of this stigma? Could it prevent some from wanting to get tested or even seeking treatment?
It is indeed. I think one of the things that we must remember is that COVID-19 is a new disease. So it's very, very new. And new things that are not properly understood come with fears. So those fears, anxieties, and confusion are what are causing this kind of stigma. Now, post this stigma or after this stigma, what is going to happen is that people who are afraid and are not aware and don't have enough knowledge will continue to fear to be stigmatized themselves after coming forward, even if they're coming forward for a test. I've seen someone indicate on social media that people are even afraid to call ambulances for their wives or mothers or sisters when they are pregnant, when they're in labor, because they will think, the community will think the ambulance went there to pick somebody who is positive. So it's going to have long-term impact, not only on people keeping away from presenting themselves for checkup, but also on other health services where people may need to get emergency services, and they fear that they'll be stigmatized by the community because an ambulance was seen at their house. And finally, also stigma in the hospital, and people stigmatizing hospitals and refusing to go for care because they may be seen to have had COVID-19, and maybe that's why they went there, or even when they go there, they may fear that they may get infected. So these are issues of that are solid enough that require us all to address.
And of course, Dr. this is not just happening in Kenya, it's happening around the world. But tell me this, let's put ourselves in the shoes of someone tonight who's watching this program from a quarantine center or from a hospital where they are being treated for COVID-19. They're on the path to recovery, they're about to be released. What would you tell them in terms of how they can mentally prepare themselves for when they will attempt to reintegrate back into society?
The first thing is to get adequate information, and we are encouraging the people, under the Ministry of Health and others who are running the quarantine centers to ensure there is adequate information for everybody who is in isolation and quarantine, so that they can actually appraise themselves with, what is COVID-19, how does it spread? To know that many people will be asymptomatic, many people will get through it, it comes and goes, it's not a chronic disease, it's an acute infection. So people understand these things. That's the first thing. So the next thing is around seeking counseling. We know that we are working closely with the Red Cross, Kenya Red Cross, and they are running a counseling line, 1199, and we encourage those people who feel the fears and anxiety to call this line and receive counseling. The final thing is to keep in touch with the outside world, because a lot of times when we are talking about social distancing, we should not distance people socially, we should distance people physically. So keeping in touch with the people, the family, friends outside, talking to them, your experiences, sharing your stories to your friends, kind of also prepares you that when you go out, you're not meeting a world that you have not been used to, that you have not been in touch with, and you've not been in contact with.
My final question, and on the flip side of that, now speak to that person who knows that their neighbor, their family member, for example, spent time in a quarantine center or were isolated or are being treated, what would you tell them in terms of how to treat someone who was suspected of having COVID-19 with dignity, despite the fear of the disease that is still very real? What's your message to them?
I would ask them one question. If they had a child who had measles, would they want that child to be stigmatized? Would they want neighbors and families to avoid their child because they had measles? This is the same thing. It's a viral disease. You know, COVID-19 is a viral disease. So this is the time to show humanity. But most importantly, for you to prepare yourself is, again, to have adequate information, honest, open conversations about COVID-19, have adequate information, and also keep in contact with those people. I was talking to some of the people running these centers, and he's telling me now they're providing Wi-Fi in these centers to allow the people who are in isolation and quarantine to live a life that's as normal as possible and be in touch with the people they're going to meet after, so that even when they go, they don't look like strangers because they have been away in a land unknown for 14 days. It must not be being away from your family, even being in isolation, maybe in isolation physically, but socially. Keep contact with them, because then it prepares you for when they come back. Have adequate information, and also we must emphasize the effectiveness of the control measures so that people don't have fear, that when you take the right measures, even if you're taking care of somebody who is positive, it doesn't matter whether Wangui was positive or negative. There should be no stigma for any of the people. So just prepare and believe, and we must emphasize the effectiveness of the measures that we are putting in place.
A very important conversation to have, bearing in mind the numbers still continue to go up. More people will contract COVID-19. We believe more people will recover as well, but the stigma is something that we all have to deal with. Thank you so much, Dr. Githinji Gitahi.